As a podiatrist with years of experience treating patients, I've come across numerous cases of edema and observed several key signs and symptoms. In this video, I'll be delving into the world of edema and its manifestations and share my clinical observations along the way. So let's get started. Before we delve into the signs and symptoms, let's begin by understanding what exactly edema is. Edema refers to abnormal accumulation of fluid in the body's tissue, causing swelling and discomfort. It can occur in various parts of the body, including the feet and ankles, which is particularly relevant in my field as a podiatrist. Number 1. Swelling. Swelling is one of the primary key indications of edema. As a podiatrist, I have often observed patients coming in with visible swollen feet and ankles. This swelling can range from mild to severe, and it may cause discomfort or pain. The extent of swelling can vary from person to person. In some cases, the swelling may be localized to a specific area, such as the ankle or on top of the foot. In other instances, it may affect larger portions of the foot or extend up the leg. The swelling caused by edema is typically characterized by an accumulation of excess fluid within the tissues. This fluid retention occurs due to various factors such as poor circulation, increased capillary blood return, or disruption in the body's fluid balance. It's important to note that edema related to swelling is often bilateral, meaning it affects both feet or ankles symmetrically. Aside from the visible swelling, individuals with edema may experience discomfort or pain in the affected area. The swelling can exert pressure on the surrounding tissues, nerves, blood vessels, leading to sensations of tightness or even aching. It can also affect one's ability to walk or engage in regular activities comfortably, further impacting their daily lives. Number 2. Puffiness and tightness. Edema can also manifest as puffiness and tightness in the affected area. Patients frequently describe the sensation of the skin being stretched due to excessive fluid buildup. This puffiness occurs due to accumulation of excess fluid within the tissues. Patients frequently describe a sensation in their skins feeling stretched or tight, which can be attributed to the increased volume of fluid retained in the affected region. This tightness is often noticeable when comparing the swollen area to surrounding healthy tissues, as the affected area may appear more fuller and more distant. The puffiness and tightness associated with edema can particularly be bothersome to some individuals. The increased fluid retention causes the tissue to expand, leading to a feeling of pressure and discomfort. This sensation may be more pronounced when standing or walking for an extended period of time, as the gravitational force exacerbates the accumulation of fluid in the lower extremities. It's important to recognize that the puffiness and tightness experienced in edema can vary depending on the severity and duration of the condition. In some cases, individuals may only notice a mild puffiness or a subtle tightness in the affected area. However, in more severe cases or instances of edema, the puffiness can be visible and noticeable and the tightness more pronounced. As a podiatrist, I pay close attention to the symptoms when evaluating my patients with suspected edema. The presence of puffiness and tightness in conjunction with other signs and symptoms helps in establishing an accurate diagnosis and in formulating an appropriate treatment plan. Number 3. Skin discoloration. Another significant symptom I've noticed is changes in the skin color. Edema can cause the skin to appear reddish or bluish due to poor blood circulation caused by the fluid accumulation. It's important to pay attention to these color changes as they may indicate underlying issues. This occurs due to the pressure exerted by the accumulated fluid on the blood vessels, which can result in vasodilation and increased blood flow in the area, which means the blood vessels open up and cause more fluid and blood to enter the area. As a result, the skin may appear flushed or reddish. In certain cases, especially when the edema is more severe or long-standing, the skin may exhibit a bluish or purplish hue. This bluish discoloration or cyanosis is indicative of reduced oxygenation in the tissues. The impaired circulation caused by the fluid accumulation can restrict the flow of oxygenated blood, resulting in this color to change. Skin discoloration associated with edema serves as an important indicator of underlying issues. It suggests that there may be compromised circulation in the affected area, which can have implications for tissue health and healing. Identifying these color changes prompts further investigation into root causes of edema and guides appropriate treatment strategies. It's important to note that the skin discoloration alone may not be conclusive evidence of edema, as there are other conditions and factors which can also cause changes in the skin color. However, when combined with other signs and symptoms of edema, such as swelling, puffiness and tightness, skin discoloration becomes a valuable piece of the diagnostic jigsaw puzzle. As a podiatrist, I carefully assess the skin color in the affected area during my examination. I compare it to the surrounding healthy skin and take note of any deviations or abnormalities. This comprehensive evaluation helps in determining the severity of the edema. Number 4. Skin texture. In my clinical experience, I've observed that edema can affect the texture of the skin. Through my clinical observation as a podiatrist, I've frequently noticed that alterations in the texture of the skin in my patients with edema. These changes provide valuable insights into the nature and extent of the condition. One common texture change observed in the edema is increased smoothness of the skin in the affected area. As fluid accumulates within the tissue, it fills the spaces between the cells, resulting in smoother surface. This smoothness can be more pronounced compared to surrounding healthy tissue, providing a tactile indication of presence of edema. In addition to the increased smoothness, the skin affected by edema may also appear shinier than usual. Another texture change commonly observed in edema is stretched or tight sensation in the skin. As the fluid accumulates, it exerts pressure on the surrounding tissues, leading to a feeling of tightness and stretched skin. This texture change is often perceived by patients and contributes to the discomfort associated with edema. It's important to compare the texture of the swollen area to the surrounding healthy tissue for a comprehensive evaluation. This allows for a better understanding of the extent and severity of the edema. By assessing the skin texture, I can gather valuable information that aids in the diagnosis and treatment planning process. While skin texture changes are indicative of edema, it's essential to consider other factors that can affect skin texture, such as age, underlying skin conditions, or previous injuries. Number 5. Feeling of leg heaviness. Many individuals experiencing edema also report a sensation of heaviness in their legs. This feeling can make it challenging to move or walk comfortably, affecting one's overall mobility. The heaviness in the legs is typically attributed to the increased fluid accumulation in the affected tissue. As edema progresses, the excess fluid puts additional pressure on the muscles and tissues of the legs, resulting in a sense of weight or burden. This heaviness can be particularly noticeable towards the end of the day or after a prolonged period of standing or walking. The feeling of leg heaviness can significantly impact a person's mobility and their overall quality of life. It can make it challenging to engage in regular activities or maintain a normal gait pattern. Individuals may experience fatigue more quickly and might find it difficult to move or walk comfortably, leading to a decrease in their physical activity levels. In my clinical experience, I have observed that the severity of leg heaviness can vary among individuals. Some may even experience mild sense of heaviness, while others may find it more pronounced and more debilitating. The heaviness may be localized to a specific area, such as the calves or ankles, or it may extend throughout the entire leg. It's important to note that the feeling of leg heaviness can have various underlying causes, and edema is one potential factor. Other conditions such as venous insufficiency, deep vein thrombosis, or musculoskeletal issues can also contribute to this symptom. And now I would like to take a moment to thank our sponsors for this video, Relief Genius Cold Therapy Socks with reusable gel ice packs. If you're looking for effective relief from a wide range of conditions including sprains, muscle pain, bruises, swelling, edema, chemotherapy side effects, arthritis, and postpartum foot discomfort, these cold therapy socks are an excellent solution. The gel ice packs can be easily chilled in the freezer and then inserted into the pockets of the socks. The combination of cold therapy and compression helps constrict blood vessels, reducing fluid buildup and inflammation, minimizing the risk of cold injury. I've personally had the opportunity myself to try out the Relief Genius cold therapy socks on my father-in-law, and I have to say I was extremely impressed with their effectiveness in reducing ankle swelling and providing relief for him. You can find more information about purchasing these socks in the link which is provided in the description below. Number 6. Skin that holds a dimple, which is known as pitting edema. When pressure is applied to the swollen area, such as by pressing a finger into the skin, it leaves a temporary temporary indentation or a pit that takes a few seconds to resolve. This occurrence indicates the presence of excess fluid within the tissue. Pitting edema is characterized by the ability of the skin to hold a dimple or pit when pressure is applied and then released. This sign serves as a valuable clinical observation in diagnosing and assessing the severity of edema. The ability of the skin to retain this indentation is a direct result of excess fluid accumulation within the tissues. The fluid buildup causes the skin to become more compliant, allowing it to hold the pit. The depth and duration of the pit can vary depending on the severity and duration of the edema. Pitting edema is graded based on its severity. Grade 1 pitting edema leaves a small indentation that resolves quickly, usually within a few seconds. Grade 2 pitting edema results in a deeper pit that takes a longer time, typically around 10 to 15 seconds to rebound. Grade 3 pitting edema causes a much deeper pit and may take up to 30 seconds or more to resolve. In severe cases, grade 4 pitting edema can occur, where the pit remains indented for extended period of time and does not resolve at all. The use of ice packs to reduce swelling, including swelling associated with edema, is a commonly employed technique in clinical practice. Let's delve into the evidence supporting the effectiveness of ice packs and exploring the science behind their mechanism of action. There are numerous studies published in the PubMed journals that have investigated the use of cryotherapy, which includes the application of ice packs in reducing swelling. One study published in the Journal of Athletic Training examined the effectiveness of cryotherapy on acute ankle sprains and found that ice therapy significantly reduced swelling compared to a control group. Another study published in the Journal of Rehabilitation Medicine demonstrated that cryotherapy was effective in reducing swelling and pain in patients with chronic venous insufficiency-related edema. The mechanism of action behind the effectiveness of ice packs in reducing swelling lies in the ability to induce vasoconstriction and decrease blood flow to the affected area, meaning that it helps to constrict the vessels, which reduce the amount of fluid that can enter the tissue. When ice is applied to the skin, it causes local cooling, which constricts the blood vessels, thereby reducing the amount of fluid that enters the tissue. This vasoconstriction helps limit the accumulation of fluid associated with edema and promotes the reabsorption of existing fluid back into the circulatory system. To use ice packs safely and effectively, it is important to follow certain guidelines. Here are some key points to consider. Timing. Apply ice packs as soon as possible after the onset of swelling. Early intervention can help minimize the extent of swelling and prevent further fluid accumulation. Duration. Apply the ice packs approximately 15 to 20 minutes at a time. This duration allows for effective cooling without risk of tissue damage or frostbite. Compression helps minimize swelling by applying a gentle pressure, while elevation promotes fluid drainage from the affected area. Individual tolerance. Monitor your response to the ice pack therapy. Some individuals may be more sensitive to cold than others, so it's important to ensure their comfort and safety during the treatment. While ice pack therapy can be beneficial in reducing swelling, it's important to note that it may not address the underlying cause of edema. However, it's also important to note that some of the causes don't have any cures, while some actually do. Addressing the root cause can go a long way, and you might want to check this other video, which is the 17 causes of swelling within the ankle, feet and legs.